Okay, if you've ever dealt with the burning, urgent, and just deeply frustrating pain of a bladder infection, well, you know exactly how miserable it is. But for millions of women out there, the real nightmare isn't just getting one. It's the fact that they just keep coming back. You finish your antibiotics, you finally feel normal again, and then bam, a few weeks or months later, that exact same pain is back. So why does this happen? And honestly, more importantly, how do we actually stop the cycle?
To really wrap our heads around the scale of this, just look at this number. 60%. 60% of women are going to have at least one urinary tract infection in their lifetime. Just to put that into perspective, only about 10% of men will ever deal with this. But here's the part that's truly concerning. For a massive chunk of that 60%, this isn't a one-off thing. It becomes this chronic, recurring battle. So, welcome to this explainer. Today, we're finally putting an end to the confusion. We're doing a deep dive into the actual science of urinary tract infections. We'll unpack why certain life stages make you uniquely vulnerable, why your quote-unquote recurrent UTI might not even be a UTI, and honestly, the best part, we'll look at some revolutionary new treatments offering long-term relief without having to rely on those endless cycles of antibiotics. Here's our quick roadmap for today. We're going to cover understanding UTIs, pregnancy and menopause, a section called Is It Really a UTI?, behavioral risks, the antibiotic resistance crisis, and finally, new non-antibiotic treatments.
Let's dive right into Part 1, Understanding Urinary Tract Infections.
Before we can talk about stopping these recurrent infections, we really need to know what exactly we're fighting. And looking here, notice the sheer dominance of one specific bacteria. If we look at uncomplicated UTIs, so your standard infections in otherwise healthy people, that massive slice taking up 75 to 95% of cases, yeah, that's uropathogenic E. coli. Now, it lives perfectly naturally in the gut, but when it travels that short distance to a woman's urethra and sets up shop in the bladder, it literally wreaks havoc. For complicated UTIs, which involve things like structural issues or suppressed immune systems, E. coli is still the main culprit at 65%. But you start seeing some other opportunistic bacteria joining the party too.
Moving on to Part 2, Pregnancy, Menopause, and UTIs. Okay, so we know female anatomy, specifically having a shorter urethra, makes women way more susceptible to these bacteria. But your risk isn't just a flat line. It changes dramatically depending on your stage of life. Let's look at pregnancy, for example, which is a factor in about 8% of cases. When you're pregnant, your body is in this crazy hyperdynamic state. The hormone progesterone actually relaxes the ureters. Those are the tubes from your kidneys to your bladder, causing them to dilate. Add a growing uterus physically pressing down on the bladder, and basically you've created the perfect reservoir for urine to just sit there. And when urine sits, bacteria multiply. If left untreated, even if you don't feel any symptoms, these infections during pregnancy are incredibly dangerous, massively bumping up the risk for kidney infections and even preterm delivery.
But hey, this vulnerability doesn't just magically disappear after your childbearing years. Actually, scratch that, it gets worse. For premenopausal women, the rate of recurrent UTIs hovers between 19 and 36%. But after menopause, that risk skyrockets to a staggering 55%. Seriously, if you're an older viewer and you found yourself suddenly battling constant infections out of absolutely nowhere, you are not alone. The data completely validates what you're going through.
So why the massive statistical jump? Well, it's basically a biological domino effect. During menopause, estrogen levels naturally drop. That drop in estrogen leads directly to a decrease in the vagina's protective bacteria, known as lactobacilli. Normally, these lactobacilli are like the bouncers at a club. They produce lactic acid to keep the environment totally hostile to bad bacteria. Without them, the vaginal pH rises and becomes way less acidic. And boom, you've suddenly got the perfect welcoming environment for pathogens like E. coli to thrive and keep invading the urinary tract.
Which brings us to Part 3. Is it really a UTI?
All right, here's a major plot twist for you. What if you've taken the antibiotics, done everything right, but the burning, that awful pelvic pressure, and the constant urge to pee just will not go away? Well, there is a very real possibility that your recurrent UTI isn't actually an infection at all. Let's compare these two conditions. A traditional UTI is bacterial. It shows up on a standard urine culture, responds pretty quickly to antibiotics, and it's a short-term thing. But on the other hand, we have interstitial cystitis, or IC. IC is a chronic inflammatory bladder condition. There are absolutely zero bacteria involved, which means antibiotics will completely fail to fix it. Instead, IC flares are usually triggered by stress or even things like caffeine, citrus, or spicy foods. So if your urine tests keep coming back totally negative for bacteria, but you've been having symptoms for over 6 weeks, you might actually be dealing with IC.
And the absolute tragedy here is how often this gets misdiagnosed. According to clinical data, nearly 90% of women with interstitial cystitis symptoms have never received a formal diagnosis. Let that sink in for a second. That means millions of women out there are enduring years of completely unnecessary suffering, going through endless rounds of useless antibiotics for a bug they don't even have, all because their true condition is flying completely under the radar of their doctors.
Let's look at Part 4, Behavioral Risks and Hygiene.
Now, assuming you do actually have a bacterial UTI, everyday habits really do play a massive role. Anatomy and hormones definitely lay the groundwork, but specific behaviors heavily influence whether that E. coli actually makes it into your bladder. A recent study tracked the habits of women with recurrent UTIs versus those without, and the numbers are pretty wild. Look at that first point. Not peeing after sex is literally the single biggest behavioral risk factor. It increases the chance of a recurrent UTI by over 11 times. Wiping from back to front instead of front to back, that boosts the risk by almost 5 times. Having intercourse during menstruation increases it by 4.5 times. And just touching the genital area without washing your hands first almost doubles the risk. I mean, these are simple, modifiable everyday things, but statistically they have a massive impact.
Moving to Part 5, the Antibiotic Resistance Crisis.
Here's the thing. Even with picture-perfect hygiene, infections still happen. And for decades, the medical response was super simple. Here, just take a pill. But antibiotics are rapidly becoming a short-term fix, with some seriously diminishing returns. Around 30% of women treated with antibiotics are going to suffer a recurrence within just 6 months. Throwing constant, broad-spectrum antibiotics at these issues, especially if it's actually a misdiagnosed IC case, is just devastating your body's natural protective microbiome, and worse, it's breeding antibiotic-resistant superbugs. We are literally reaching a point where standard drugs are failing us. We absolutely need better alternatives.
And that leads us to our final section, Part 6, New Non-Antibiotic UTI Treatments.
Luckily, the scientific community has been hard at work. We are now seeing that if you combine specific non-antibiotic therapies, you can actually disrupt the infection cycle from multiple biological angles. Take D-mannose, for example. It's a type of sugar that acts like a decoy. It literally binds to E. coli's microscopic hooks so they can't latch onto your bladder walls. Then you have probiotics, specifically lactobacilli, which help restore that acidic vaginal pH we lose during menopause, basically crowding out the bad guys. Cranberry extracts physically prevent bacteria from sticking to the urinary tract lining. And potassium magnesium citrate, it actually alkalinizes your urine, which rapidly takes the edge off that terrible burning pain when you pee. The studies are showing that combining these exact elements can dramatically drop recurrence rates, all without a single antibiotic.
But honestly, the biggest medical breakthrough right now might be in immunology. Researchers have developed MV140, and it's a revolutionary oral vaccine for recurrent UTIs. And no, it is not a shot. It is a pineapple-flavored spray. You literally just apply it under your tongue every day for 3 months. Dr. Bob Yang, a consultant urologist, says this could be an absolute game changer for prevention. It could restore patients' quality of life and massively slash our reliance on antibiotics. And the long-term data for this is just incredible. In a recent 9-year follow-up study of patients using the MV140 spray, 54% remained entirely UTI-free for almost a decade. Just think about that. More than half the patients, people who used to suffer from constant, painful, recurrent infections, had 0 infections for 9 whole years after just 1 3-month course of this vaccine spray. That is a real game changer.
So, we have covered a ton of ground today, from the cascading effects of menopause and the hidden dangers of misdiagnosed interstitial cystitis to the really exciting promise of non-antibiotic treatments and brand new vaccines. So, I want to leave you with this. If you find yourself trapped in that exhausting cycle of recurrent bladder pain and just endless antibiotic prescriptions, is it time to advocate for yourself, rethink your diagnosis, and maybe explore some of these new scientific solutions? Because armed with this knowledge, you now have the power to actually take back control of your health. Thank you so much for joining me on this explainer. Keep learning, keep asking questions, and I will see you next time.